Hi, my name's Caroline, and my presentation will be on communicable diseases. Communicable diseases are diseases that are spread from one person to another or from an animal to a human. Communicable diseases affect all populations from children to the elderly, and children and the elderly are the more vulnerable population. This is because children's immune systems aren't fully developed yet, and with the elderly, the immune system is weaker than in your middle years, so you're more prone to getting diseases. Every communicable disease can be spread in different ways, but ways of transmission include skin-to-skin contact, airborne, skin to objects, and sexually transmitted. In the 1970s, many experts thought the fight against infectious disease was over. In fact, in 1970, the Surgeon General of the United States indicated that it was time to close the book on infectious diseases. This came from the World Health Organization. They believed that communicable diseases weren't so much of an issue anymore, and they wanted to change the focus to something else. Communicable diseases are still a severe problem today, accounting for 63% of all children death and 48% of premature deaths. And communicable diseases are a severe public health issue because they can cause health issues in individuals and are highly contagious. They need to be stopped before outbreaks occur. This is what we do as public health officials. We try to find the issue and how to stop outbreaks from getting worse. This is just a short video, about 2 minutes, on just like the breakdown of what a communicable disease is and ways of transmission. If you have time, I would strongly encourage clicking on the link and watching it. Some diseases that are classified as communicable diseases are chikungunya, which is a mosquito-borne viral disease. You have chloria, which is a bacterial disease of the small intestine causing diarrhea. Crimin Congo, which is a viral fever transmitted by ticks. You have the Ebola virus, the Hendra virus infection, which is a viral disease from fruit bats. Influenza, Lassa fever, which is a viral infection contracting from humans' urine or other bodily fluids. You have the Marburg virus disease contracted by prolonged time in mines or caves. Meningitis, the plague, which is a viral and extremely deadly infection from small mammals and their fleas. Smallpox, yellow fever, Zika, and of course the common cold. So that list of diseases was more common outside of the US. It's rare for them to happen here. This list of diseases are more common to happen here. HIV, there's 1.1 million people living with HIV and AIDS in the United States. Whooping cough, the common cold, gastroenteritis, strep throat, hepatitis, and rotavirus. A lot of these you can actually get vaccines for to, expose your body early, and this way, if you're ever exposed to the live disease, your body knows how to fight it off. Some risk factors, endemic and epidemic diseases that are common in the area. So if you're living somewhere and there's a disease outbreak, obviously you're at risk for getting that disease. Living conditions of the affected population, availability of clean water and adequate sanitation facilities, underlying nutritional status and immunizations. Again, if you don't have the correct immunizations or you lack them, this is obviously putting you at great risk for getting these diseases. Also, nutritional is important too, because if you're not eating a healthy, balanced diet, it lowers your immune system. You're more susceptible to getting them. Access to healthcare is a big one too. If you catch one of these diseases, if you don't have any health insurance, it's hard to go to the doctor. Hygiene, stress factors, lifestyle choices, which include cigarette smoking, alcohol and drugs, and your age. Because like I said before, children are more prone and the elderly are more prone. This is just a picture to show you just different ways of transmission for communicable diseases. The first one is infection caused by airborne, so through the air if someone sneezes and you're by them. Infection caused by contact, hand to hand. So if it's on someone's hand, they touch you. Infection caused by contaminated water. Someone drinks water and then you share it. And infection caused by pathogens in bloodstream and tissues. This again is like bodily fluids, anything like that. So risk factors for non-communicable diseases, it does say NCDs, which are non-communicable, but I added this because I feel like some of these can go for communicable diseases as well. So non-modifiable age, gender, family history, ethnicity, or prior stroke or heart attack. These are obviously things that you can't change. And modifiable, unhealthy diet, high blood sugar levels, smoking, high blood pressure, high cholesterol, physical inactivity, overweight, excessive alcohol, and stress. So this list on the right, you can, change your lifestyle, like anything that you're doing, but the non-modifiable, those are just risk factors that you can't do anything about. Some data and statistics. The influenza 2015 taken from the CDC. These statistics are from 2015. The percent of children aged 6 months to 17 years who received an influenza vaccination during the past 12 months was only 49.9%. Percent of adults aged 18 to 49 who received an influenza vaccination during the past 12 months was 31.8%. Percent of adults aged 50 to 64 who got the shot in the last 12 months was 45.2%. And percent of adults aged 65 and over who received an influenza vaccination in the past 12 months was 67.2%. And the influenza caused 5,251 deaths. And again, this is just a short video. I think it's actually 4 minutes long, so I'm not going to open it in here, but if you have time, click on it. Some more statistics. Sexually transmitted diseases, again, from 2015, taken from the CDC. The number of new syphilis cases in 2015 was 74,702. Chlamydia cases was 1,526,658. Gonorrhea cases was 395,216. HIV and AIDS in 2015, taken from the CDC. HIV diagnosis was 39,513. 41.1% of adults aged 18 and over were tested for it. That number should be a lot higher. And HIV and AIDS caused 6,465 deaths in 2015. Pneumonia, again, 2015, taken from the CDC. Percent of adults aged 65 and over who had ever received a pneumonia vaccination was 66.9%. And number of visits to the emergency department with pneumonia as the primary hospital discharge diagnosis was 423,000. And pneumonia caused 51,811 deaths in 2015. Some prevention education. We can provide educational information to people across America and the globe on infectious diseases. Provide education on how they are spread and how to protect yourself. Promote vaccines to prevent infectious diseases. As public health professionals, we need to continue investigating outbreaks and encourage people to continuously be safe, get tested, and have proper hygiene. And continue creating programs to educate, prevent, and protect the community against these communicable diseases. So just teach people how to, wash their hands and cover their mouth when they sneeze, and the importance of these diseases, because a lot of times people just brush them off and they don't think they're so severe, but they are still an issue today. This link down here will bring you to another video, just how we can stop the outbreaks of them and teach people how to educate themselves on communicable diseases. And these are my references. Thank you.